All right, so I'm a clinical psychologist. I work in gynae oncology in Newcastle in the Hunter region, so with one of the specialist gynae oncology centres. And today I'm going to run you through, why ovarian cancer is hard. And it's hard because it doesn't just hurt our ovaries and our girls' bits, it hurts our heart as well. And often that's something that we don't talk a lot about. And all cancer hurts our heart in terms of our emotions. It makes us think about things we don't necessarily want to think about. So for some of us, it makes us think about dying, sometimes a lot. For most of us, it makes us see our body in a different way and think about our health in a different way. And that's confronting as well. It can make us think about leaving the people that we love. And sometimes that can be one of the most confronting things that it does to us. But it can also change the way we see ourselves. It changes the way we feel, not just the cancer, but the treatments that we give. And so our sense of confidence in our body and ourself changes. Our sense of who we are in the world changes. Our ability to act in our roles, the jobs that we do at home and at work may change. When we're post-surgery and we have to Tyrannosaurus Rex arms for a while, that just physically stops us from being ourselves. But it can also emotionally stop us from being ourselves. And it can also change the way other people see us. And they might be our colleagues at work, they might be our family at home, they might be our friends, there might be people in the street that give us a pitying look when we walk past them. There's a whole range of change that happens. And emotionally, that can be really, really difficult to deal with. Your mood will go like this through the trajectory of your disease, and you can't predict where it's going to be on any given day. And so lots of things can trip you up emotionally. This changes our life. It wouldn't matter if someone said to you, look, I'm sorry, we made a really terrible mistake, and actually you don't have ovarian cancer. Your life would still be irrevocably changed. You would still look at the world differently. You would still feel differently about things. And so it's actually really important that we just learn to think about and acknowledge this change as a normal thing. It's not necessarily a pleasant thing. It's not necessarily something we would sign up for, but it happens. And often we get caught in not talking about this stuff. And so today I'm just going to run us through some of this stuff, because cancer is traumatic. Being told you have cancer is traumatic. Having to wait until you start treatment is traumatic. Having treatment is traumatic. Stopping treatment is traumatic. Not being on treatment and waiting, is it going to come back, is traumatic. And one of the things we know about trauma psychologically is it's cumulative. So trauma builds on trauma, builds on trauma. So what do we do when we treat you for cancer? We re-traumatise you. And what happens when you make friends with other women going through the same experience and you lose them? That's traumatic. That adds in that amazing guilt that you have if you're surviving. There's a whole heap of emotional stuff that cancer does to us. And all of this is in this world of uncertainty that a diagnosis puts us in. I often say to patients, being diagnosed with cancer is a little bit like suddenly waking up and standing on a beach that you've never been on before, and someone you've never met before goes, oh, hi, you've got ovarian cancer. I'm going to be your care coordinator and I'll help you work out where you're going to go. And so the first thing we're going to do is maybe we're going to do some surgery. And so I'm going to pop over to that little island you can see just over there, and I'll be setting everything up for you with the surgeons. And meanwhile, here's your coracle. And they give you one of those little shell-shaped boats that you might have seen if you've ever read any Celtic history or watched movies. You have to balance in them and paddle. You just hop in your coracle and get yourself to that island, and I'll meet you there. And this is what we do again and again. And then finally you get to a point where we're saying, you know what, there's no treatment for a while. And then we say, so we'll be waiting, if you need us, on an island that's just over the horizon that you can't even see. And so you don't even know where to head. And uncertainty is something that's deeply uncomfortable for us as human beings. We like to know stuff. We like to know what's going to happen next. We like to have a plan. We like to know if we're going to have really awful treatment that it's going to work. We desperately beg people to give us certainty, and they won't. And the more we try and get certainty from the doctors, the less likely we are to get it, because we just don't know. And so psychologically, that combination of reoccurring trauma and that uncertainty just puts you in a really dicey place. We know that cancer and its treatment can cause depression, anxiety, fatigue, cognitive changes and neuropathic pain. We actually have evidence that's starting to come out that suggests that part of that is actually caused by an inflammatory response that our body has to the cancer. So quite often one of the things that stops us from talking about the emotional impact of cancer is a belief that somehow, if I'm not coping with this, I'm weak. That I should be able to carry this burden on my own. And yet one of the things we know is, irrespective of your coping style, of how successfully you've coped with things in the past, with how well you do under pressure, the cancer itself and the treatment we give you could be actually significantly contributing to this level of emotional impact, this mental health stuff. So if we look at the rates of depression in ovarian cancer, we've got really good evidence from a meta-analysis, so a big study where people look at all the studies that measure these things. So 3,623 patients, 25% of those patients, that's a quarter of those patients, were considered to be experiencing clinically significant levels of depression before they started treatment. Okay, that's a quarter of us in the room today. On treatment, depression drops only a little bit, down to 23%. But after treatment finishes, it drops really significantly to about 13%. Now, if you think about treatment, it's not too hard to understand why. It's a pretty difficult thing. It's hard to keep going through. But if we look at clinically significant levels of anxiety, they're quite low compared to depression, 15 to 19% before starting treatment. And it's easy to be not anxious before you start treatment because you don't know what it's like. Once you've had treatment once, that anxiety increases because you actually know what you're going to have to try and get through. Anxiety jumps to 26% while you're on treatment, and it stays at about that level after you've finished. And part of what I'm going to talk about in a minute is fear of recurrence and how much that can contribute to anxiety. I'm not sure which bit I'm supposed to point it at. If we think about some of the special bits about ovarian cancer that make it hurt our hearts so much, everyone has mentioned the fact that most ovarian cancers are diagnosed at a late stage. And that just makes it harder because the opportunity for early intervention is gone and there's extensive disease. We don't have the same ability to treat that. And so emotionally, that has its own impact. We know the survival statistics are much worse than for other cancers. We know that one of the most important things we can do is maintain our hope, but it's pretty hard to read those statistics and feel like you're realistically maintaining hope. But luckily, hope springs eternal, and we do manage to tap into that. One of the things that I think is saddest in ovarian cancer, we think that we should be able to carry this burden ourselves. So we did a study in Newcastle where we asked women, we screen everybody using a distress thermometer, which is a little simple one-item scale that just asks how distressed you are, with 0 being in the last week, I haven't been distressed, and 10 being I've been the most distressed ever. And we know from lots of other work that if you score at 4 or above, there's a pretty good chance that you've got clinical levels of anxiety or depression. So all we did for all the women that scored at 4 or above, we asked them whether they'd like an appointment to see a clinical psychologist. Now, there's a big stigma around seeing clinical psychologists. Because if someone wants you to see a clinical psychologist, you must be crazy, right? No. The clinical psychologist might be crazy if it's me. You'd have a much better deal if you got Mandy. She's a lot saner than I am, I think. But what people are suggesting when you see, maybe you'd like to talk to the psychologist is just talking to someone who can help be a navigator through this journey. My job is to sort of stand around on the corner and people pull over in their ovarian cancer car and go, "Hey, Kath, I'm here and I want to get to here and I'm not sure which way to go. Can you give me a hand?" And literally my job is just to listen to what's happening for them and listen to where they want to be and just make some suggestions. Maybe you could try this or this or this. And it's always going to be up to the person to decide what they do. When we asked these women who we knew were likely to have either anxiety or depression or both, whether they'd like to see the psychologist, 76% of them said no. And the thing that breaks my heart is not that statistic, because it's hard to have to see a psychologist, I guess. That when we asked them why they didn't want to see the psychologist, nearly all of them said, "Because I should be able to do this on my own." Why do we have this expectation of ourselves? Why do we think we can put on our Supergirl undies and cope with all this stuff? So one of the things I would ask you to do is just think about, if someone offers you help, just think about accepting it. Don't feel like you have to do this on your own. This is tough. And it's tough all the time. And if you come and see someone like me, I'm a bit of a wimp, so you can make me cry. But you can't make me feel guilty. And you can't let me down. And you can't burden me. You can't do all the things you do and worry about that stops you from talking to the people that you love. So please just think about that fact. One of the other things that makes it harder to deal with ovarian cancers than others is that fact that it is very likely to come back. It's hard to not remember that. It's hard to not get paranoid about what this ache might mean, what this pain could be, what this change is. And every time, as I said, it comes back, it's more traumatic. And then just adding a little extra thing into the mix is what happens to our sexuality when we get diagnosed with an ovarian cancer, and more importantly, when we get treated for it. If we're premenopausal, we become menopausal, most likely. If we're postmenopausal, we become super postmenopausal, depending on the treatments they give us. And so we go from having whatever sex life we had, with whoever it was with, to losing interest in sex, to being frightened to be intimate, to being able to feel our vaginas when we walk because they're so dry. There's a whole heap of stuff that changes around that. And so at a time in our lives where we most need support from the people that we're intimate with, we're least able to access it. So can somebody please explain to me how you guys are supposed to be able to manage all of this on your own? That's a whole heap of emotional burden. Oops, wrong way. Yep, and again. So some of the unhelpful thoughts that we have. Who's heard somebody tell them that you just have to stay positive? Yeah. Who's good at being positive every day? Yeah, no. So one of the things, it's really important to remember that the people that care about us, the people that love us, they want to be able to help us when we're diagnosed with something like this, and they can't necessarily. And so what they want to do is see us feeling better. And so there's this fantastic myth that says if you're positive all the time, you'll do better with your cancer. Yeah, there's actually no evidence that suggests that. What is important is trying to have a positive outlook, is trying to engage in realistic hope. But if you have a bad day, you're not hurting yourself. The best thing you can do is go to bed and cocoon. Just nurture yourself. Someone like me would only worry about bad days if they're happening every day for 2 weeks at a time. It's normal to have flat periods. It's part of the process. Don't feel like you're somehow harming yourself. Some women will say, I did this to myself. I didn't look after myself. And that's a pretty common feeling, that I should have known that something was wrong. But one of the biggest problems we have, and it's one of the reasons we don't diagnose ovarian cancer early, is because every single symptom is something that as women we've probably been experiencing since we started menstruating. One of the gynecological surgeons that I work with, who's a male, claims that he suffers from ovarian cancer every Boxing Day because he has a sense of fullness, of abdominal discomfort and distension, and he's often constipated. There's nothing there that says, big red flag, something's really wrong. And that is one of the most difficult things to accept, that all of the symptoms are symptoms that are normal for us. It's different to going, that wasn't there. We don't have the opportunity to do that with ovarian cancer. So it's really important to just be gentle with yourself and not get caught in the blame story, because it's a really unhelpful story that can stop you from just being here and getting on with what you need to do to be as well as you can at the moment. We often worry that we're not doing it the right way, and that can be reinforced when we get the reminder that we just have to pull our socks up and stay positive. The right way for every single one of you will be different. The right way will be what works for you, what keeps you well, what taps you into the support and the motivation that you need to keep going. And I'm really sorry I'm not going to give you any blanket strategy that if you all do will help, because this is such an individual journey, and it's really important that you check in with yourself and look at how you've coped with stress and trauma in the past and what's worked, and engage with those things. You will know yourself intuitively. Your gut will tell you what is the best way for you to be doing this. I'm just going to remind you again that you don't have to do this on your own. One of the other big things that often trips us up and we stumble over, particularly in our relationships, is assuming that other people will understand how we're feeling. Now, girls, I'm going to give you a big secret that has come to me through 30 years of practicing as a clinical psychologist. Men can't read our minds. Is that correct, gentlemen? Correct. Yes, correct. And yet, how often do we think to ourselves, how could he not know how I'm feeling? No, quite simply. Because, if you ask a boy, darling, what are you thinking? And he says, nothing. Then what he's actually thinking is, nothing. And these are gross generalisations, but look, it is really important. If you need something from someone you love, tell them. Because they're probably desperate to try and do something to help you. And they probably won't work it out for themselves. And the classic, when you get to a point where you don't have treatment for a while and people will say, you must feel great, it's all over. It's actually okay to mentally punch them, but to verbally say, it would be great if that was the case, but that's not what my story is. You'll see them disappear again, because part of what they want, part of why they want it to be over for you, is because they know how to talk to you again now. And so part of it is a responsibility to teach people how to talk to me, what to say, what I want to talk about. If you know friends are avoiding you and you really want to catch up with them, then ring them and say, can we just have a coffee and talk about the weather, please? Just give people a chance and don't expect them to know, because they just won't know. Think about it yourself. Would you have understood if this was your best friend going through it, or your sister, or your mother, or your daughter? So please take that initiative. Don't lose contact with people, and don't get upset and frustrated with people who can't understand what's happening for you. So just to quickly talk through some of the statistics around fear of cancer recurrence, and this is one of my favourite cancer comics. This was actually drawn by a husband and wife team, and the woman had ovarian cancer. And so she's basically standing at the end of her initial treatment talking to her mum and dad. And her dad's saying, honey, we think it's time you put the cancer behind you. And her mum's saying, no need to be such a gloomy Gus. And she's standing with a hole right through her body. Because that's how she feels. That's how much change she's been through. That's what's happening for her. That's why it's important we explain to mum and dad, no, it's not over. I don't feel like it's over. This is what's happening. And fear of cancer recurrence is such a common thing. It has a name, fear of cancer recurrence. We refer to it by its initials now, FCR. And they had a big consensus working group and invited all the important people internationally to decide what the definition was. And what they came up with was fear, worry or concern relating to the possibility that cancer will come back or progress. Has anyone felt that? Yeah, a couple of people, good. It is the most commonly reported challenge for all women with cancer across the board. And we know that it's very high within the ovarian cancer world. So generally it affects between 22 and 87% of all cancer survivors, and the reason that that range is so big is that the way they measure it is different in all of the studies that they've looked at. But the statistics within ovarian cancer are between 22 and 85% of women that have ovarian cancer will experience fear of recurrence at some stage during the journey. It's a normal response to have. And the very nature of ovarian cancer, makes it much more likely. One of the reasons that it's really common to have fear of cancer recurrence is because it recurs. We've just seen the statistics for how often that happens. So it's normal to have a fear that the cancer could come back. But also we've got the magical CA125. Who's got a CA125 graph? Anybody? They're often one, yeah. Look, CA125 is, it's a little bit like steroids. I often say steroids are the best and the worst medication we have. CA125 is the best and the worst thing that we have. It's something that we can hang some hope on. It gives us an idea about what might be happening with our disease. For some of us it doesn't. Pardon me. But it's also not something that just specifically measures ovarian cancer, and so our CA125 can start to climb again, and it can be a urinary tract infection or some other pelvic inflammation or discomfort. There's lots of other things that can contribute to it. So it can be one of the main things that can really increase our fear of recurrence as it's happening or not. And so the colloquium that came together and put the definition together, the clinical characteristics of fear of cancer recurrence. Now, everyone has a degree of fear. That's normal. But when it actually becomes something that we need to do something about, or when we meet these criteria, so high levels of preoccupation. So I'm worried about it all the time. It's popping back into my head. It's going around and around and around. I just can't stop thinking about it even when I try, and when I'm not thinking about it, all of a sudden I am. All right, so it's a really high degree of that intrusiveness. We start to engage in maladaptive coping, and that can be lots of different styles of coping. So one of them is avoidant coping. So I just don't go for my checkups. I don't get my blood test done. I turn up for appointments maybe, but I've forgotten to have scans. So we just avoid knowing what's actually happening. One of my favourite patients she's actually a breast cancer patient. She's in the hospice in Newcastle at the moment. She's had breast cancer for 20 years. She's actually used avoidant coping for most of that time, and for her it's actually worked really well. If you ask her, she and her oncologist had an agreement that she just wouldn't come in for follow-up. If you ask her oncologist, she was lost to follow-up. We can be really clever in how we avoid finding out what's happening. We can do the opposite, and we can seek reassurance. Now, it's normal to seek reassurance. It's only a problem when we do it again and again and again. So we're asking different people the same question. And because people never give exactly the same answer, it allows that anxiety to continue on. So one of my favourite patients who struggled a lot. She had a pre-existing anxiety condition, and I'll just give you a language warning because I'm going to quote the patient's daughter directly. I should give you a language warning anyway because I've worked in mental health for too long. But the patient was sitting in the chair being hooked up for chemo. I was walking into chemo suite. The daughter was sitting next to her. I saw the patient, her mum, ask the nurse a question, and as I arrived at the chair, the daughter threw down the magazine she was reading and said, "I'm effing sick of you effing asking the same effing question every time someone comes near us," and stormed out of chemo suite. And her little mum was sitting in the chair and she looked at me and she said, "Well, I don't know where that came from." Now, there's two important things in that story. One is we don't often recognise how our anxiety can drive us to seek reassurance. So we don't often recognise that we're actually asking the same question of everyone and we feel like we can't believe the answer. The other thing is it's very frustrating for our family members when we keep doing that. So it's just important to just think about, am I still trying to get this question answered? And look, it's normal to try desperately to get someone to go, "Yes, you're cured." That's what we all do. This is more about specific questions that you're asking again and again. The next important characteristic is whether it's causing functional impairment, whether it's actually stopping us from being able to do our job, to engage in our activities of daily living. If we can't get out of bed in the morning because we're worrying so much about what's happening with the cancer, if we can't exercise because we're worried about hurting ourselves, if we can't have our relationships with other people because this fear is overwhelming, if it stops us from going outside, if the only thing we do is go to doctor's appointments, if all of this is causing us excess distress, all right, so if it's really upsetting us, and if it's leading to the point where we just feel like we can't plan for the future. And it might be that we can't plan because we can't see a future, or it might be that we're just paralysed because if we make a plan, that might muck things up because we get magical superpowers sometimes when we have cancer. So if these things sound familiar to you, then it's possible that you've got a degree of fear of cancer recurrence that you need to do something about and talk to someone about. And like I said, I'm not going to give you any magical cure for how to deal with that because how all of you dealt with it would be a very different thing. But if you think that maybe you need help, and it might not be about fear of recurrence, it might just be because this is a really hard thing to do, then these are some of the things you can do to seek help. And the little handbook that you've got from today has an awesome list of resources. And they're just the resources that Ovarian Cancer Australia put together. These guys do an awesome job to provide as much support as they can. But please talk to people. And that doesn't have to be a professional. It can be friends, it can be family, it can be other women going through the experience. The important thing is to talk to the people who help you. Talk to people who can listen and hear what you say. But remember, when we talk our problems, when we talk them with our mouth and the sounds come out, we have to use a different bit of our brain, and so we process the information differently. And it can often, as we're talking our problems, we will think, "Oh, I know what I have to do about that." Because we're actually engaging different bits. We're engaging more with the logical bits of our brain, not the very anxious bits of our brain. So talking is really important. Please, if you need help, ask for it. I want you to think about a time someone you love asked you to help them and how nice it felt when you were able to. And so every time you let someone that loves you help you, you're giving them that beautiful gift. You're actually not being a burden. You're actually helping them to care for you. So please, ask for help. Accept help if it's offered. The proviso is if people offer to cook for you, think about giving them recipes because there's only so much spaghetti bolognese and lasagna any freezer can hold. There's lots of publicity out there around the benefits of mindfulness at the moment. But look, truly we know that mindfulness, just calming our mind, okay? It's not making our thoughts go away. There's only one way of doing that, and that's exactly the opposite to what we're trying to do at the moment. We want to be present, but just calm our mind. There's online stuff, there's apps, there's courses, there's classes. In some places you can access mindfulness-based cancer recovery groups, which is all about a mindfulness intervention that's developed specifically for people who've had cancer. And we know from the long-term data from the studies that they've done around that intervention that not only does it help with our mental health and our sense of connection, but it also increases our survival. So there are things that we can do to keep ourselves well for longer. All right, so think about accessing just something to calm this, because it can get really overactive and it can take us down paths we don't need to go. Everybody hates it when I talk about exercise, but it's really important, and the evidence that's coming out about the evidence for exercise and the benefits of exercise is overwhelming. I'm seeing doctors exercise. That's how good the evidence is. It helps with our mood. It helps with our fatigue. There's some proof that, whatever divine being there is has a very sick sense of humour, because the best thing you can do to reduce your fatigue is exercise. Whose plan was that? But it also helps in the long run. We're beginning to see evidence, again, with survival. So the sad thing is some of the things that we have to do that we know can help ourselves are actually the things that we're least likely to do, because they're a little bit tricky and you have to be a bit committed and it's cold and wet outside. But please think about tapping into these things that can help. Moving your body is really crucial. We now have Australian guidelines around moving our body regularly, and that slipping into not moving is the thing that we do through our life. So think about how you can increase your exercise a bit. And look, please, if you feel that you need some extra support, then access the support that's around. Ovarian Cancer Australia has awesome people working with it. Mandy sitting right there is one of the best psychologists you'll ever meet, ever. Don't tell her I said that, though, because I don't want her to get a big head. But there's lots of people around that you can tap into. If you're going to work with someone, a psychologist or a social worker or a counsellor, it's good to work with someone that's had some experience in cancer. Just because everybody's scared of cancer, even psychologists and social workers and counsellors, the Cancer Council also has a list of people that you can work with as well. But please just think about looking after yourself in the way that works best for you, tapping into the fact that this is hard and it's actually okay to admit that it's hard. And just look at what on that list you could do, and maybe commit to just one thing that will help you to feel better about yourself and how you're doing today. That was the headshot I was going to send you, Anne-Marie. It's a photo of me about to go into our gynae oncology MDT with my ovaries for ovaries on. And so one of my young patients, this is the gang sign for ovarian cancer. So that's actually me sending her a picture of me doing the gang sign for ovarian cancer. If anyone has any questions, I'm happy to answer them. If we need to go to lunch, I'll be around as well.